The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Hi, I'm Dr. Prince Rubio, a second-year IM resident. I'm the one who made your diagnostic exam, and I hope hindi naman kayo super na-overwhelmed. Rather, I hope you're challenged to study harder and at the same time, give you a chance to reassess, revise, and reset your mindset and game plan in the coming months to pass the PLE. So, here are my objectives when I made the questions for your exam. So besides testing your current fund of knowledge, I am seeing this as a teaching tool to help you pinpoint important concepts that are testable and are also clinically important as future MDs. So dito, I would like you to have an overview on how the questions are being asked in the PLE, some trends in the questions, and of course, their format. So I gave you here true or false questions, mga questions na merong except, mga statement questions, as well as K-type questions, yung mga kinakatakutan ng mga students. So guys, huwag kayong mag-alala kasi I'm here to provide tips on testmanship. Paano ba sila takihin along the way? And of course, studying tips on what topics to focus on per subject. At the same time, give you some inputs on how to have a basic knowledge for some of these concepts along the way. So, okay, mag-alala guys, we're here to guide you. So, just trust the process. Alright? So, with that said, my first subject is biochemistry, kung saan I'm also your future teacher here. So, let's start with question number 1. So, during collagen synthesis, which substance is not necessary in the hydroxylation step of proline and lysine? Now, for sure, you're thinking iron is part of it, right? But the correct answer here is not ferric iron. It should be ferrous iron. Okay, so collagen synthesis. Collagen is the most abundant protein in the human body. And it has 6 major steps. The first 3 are mainly located in the rough endoplasmic reticulum. But the latter 3 steps are being done at the extracellular fluid. So the first step is to synthesize a pre-pro-collagen, but afterwards, the proline and lysine residues of collagen must undergo hydroxylation. So kailangan mo dyan ng 1, vitamin C or ascorbic acid, kailangan mo ng molecular oxygen, and you need to have alpha ketoglutarate. But also, you need to have the specific form of iron, ferrous iron, the Fe2+ form, not the ferric iron. Kasi ferric iron is being used by other processes in the human body. Then afterwards, you will have here the glycosylation of the formed hydroxylysine. Then the rest of the steps are now being done at the extracellular fluid. Now, one more point of consideration here is that the cross-linking step of erythropocollagen requires copper para gumana si lysyl oxidase. So more of these in your biochem lecture. But dito, ang gusto ko niyo matandaan ay the functions of iron in the human body. So we have 2 major forms of iron that's very functional in the body. The first one is your ferrous iron or Fe2+, also known as reduced iron. And your ferric iron or Fe3+, also known as the oxidized iron. So, for you to bind oxygen to hemoglobin, kailangan naka-ferrous form yung ating iron sa hemoglobin. As mentioned, part siya ng ating hydroxylation step, ng ating collagen synthesis. And para ma-absorb ang ating iron sa ating intestine via the duodenum, kailangan naka-ferrous iron state ka rin. Okay? Take note guys, duodenum is the site of iron absorption, the major site. Now for your ferric iron, always think here of 2 things. For transport siya via transferrin attachment, and for storage siya via apoferritin attachment. Guys, iba ang ating apoferritin sa ating ferritin. Apoferritin is only protein, but if it is conjugated to iron, the ferric iron to be specific, it now becomes your ferritin substance. Number 2, what part of the immunoglobulin or antibody participates in the formation of immune complexes or antigen-antibody complexes? Now, the correct answer here is your paratope. So, immune complex formation has two important terminologies you should know. This was actually a testable question back then. So, we have the epitope and the paratope. Now, this is your antigen and this is your antibody or your immunoglobulin. Now, ang epitope, yan ang part ng ating antigen interacting to your antibody to form the complex of your immune complex. Now, the antibody naman, meron siyang paratope naman, paratope to, the one interacting with the epitope of your antigen. Okay? So guys, for a quick mnemonic here, the epitope, siya ang part ng antigen natin, the one with letter E. Okay? To prevent confusion. Number 3. Arachidonic acid is derived from this substance. The correct answer is B. Linoleic acid. Your arachidonic acid, linoleic acid, and alpha-linolenic acid are all essential fatty acids. Now, in nutrition and biochemistry, whenever you hear the term essential, ang ibig sabihin ay kailangan siya sa ating diet. Kasi humans lack the enzymes that can introduce double bonds beyond the 19 carbon. So, hindi sila kayang gawin ng ating katawan. Very important sila. They're very essential. So, ang nangyayari, you have to get them from diet, from the food we eat every day. So, we have your two major essential fatty acids, your linoleic acid and your alpha-linolenic acid. But your arachidonic acid is very important as well kasi it's the parent compound for your eicosanoids. The eicosanoids are important substances mainly for inflammation and repair. So, if kailangan mo ng ganun, you should have enough lipid nutrients sa iyong diet. Alright? So, this arachidonic acid is actually derived from your linoleic acid, one of the two major essential fatty acids. So guys, to prevent confusion, I have this mnemonic. Linolenic acid, the one with N, is not the parent compound of your arachidonic acid. Number 4. If a DNA sample has 23% adenine, what is the expected amount of guanine in percentage in the given sample? The correct answer is letter D, 27%. So let's first talk about your base pairing and hydrogen bonding. Your A adenine always binds to thymine. Your purine guanine always binds to your pyrimidine cytosine. So this is the base pairing rule of our nucleic acid formation. Now take note that GC bonding, this one, is always stronger than AT bonding. So, if stronger siya, mas mahirap siya ma-destroy. Therefore, large amounts of GC content in a sample of DNA will lead to a higher melting temperature. Melting temperature is the temperature required para ma-destroy mo ang isang substance. So, kaya siya mas mahirap kasi mas madikit ang G kay C. So guys, take note of this mnemonic of mine. GC couples flock at the library. Okay, lagi magkasama yung mga GC couple na yan. And because of that, they're stronger together because they help each other out to have high grades. So, sila ang mas stronger together. So, just simple mnemonic of mine. But going back to our question, you should also know your Chargaff's rule. It tells us that the number of purines is always equal to the number of pyrimidines. So, in a DNA sample of 23% adenine, you expect that you also have your 23% thymine. Kasi one, they are always together. So kung gaano karami ang adenine mo, ganoon din karami ang iyong thymine. Also goes for your guanine and cytosine. At the same time, per Chargaff's rule, they are always of equal amounts. Thus, kapag sinabtract mo ang kanilang overall percentage for A and T from 100%, you will have here 54% remaining, which represents your G and C. And dahil alam mo that they are always in pair, when you divide G and C content by 2, you will have 27% guanine and 27% cytosine. Hence, the answer to our question number 4. Number 5. What is the most abundant RNA in the eukaryotic cell? It is your A, ribosomal RNA. RNA is very important in metabolism, in making your amino acid sequences. Okay? And its major player is your mRNA. Okay? It's the one that codes protein. But your different non-protein coding RNAs, they help the mRNA form the amino acid sequence. So more on that on your biochem lecture. But for now, take note that your mRNA is the most heterogeneous RNA kasi nga siya yung magiging template for the different multitude of amino acids that their body can make. So kailangan usually iba-iba talaga yung format niya, right? Tapos you need to have lots of ribosomes. So your ribosomal RNA represents the most abundant RNA in the eukaryotic cell. Now your transfer RNA, ang function niya is to transfer amino acids from the cytoplasm to the ribosomes during translation. Pero ang kakaiba sa kanya, meron siya mga unusual bases na ginagamit. Meron siya mga pseudouridine, inosine na wala sa ating mRNA and ribosomal RNA natin. Kaya, your tRNA contains these unusual bases. Now, the rest of the RNAs, mga serina, microRNA, long non-coding RNA, saka yung mga serina natin, they are all important for, in summary, for gene expression regulation. So, yan yung important thing sa part na to. Number 6. What is the total amount of kilocalories found in a diet consisting of 1 gram of carbohydrates, 3 grams of fat, 4 grams of protein, and 2 grams of alcohol? So guys, okay, I think you've heard this before, but take note. Okay, the kilocalories per gram for different macromolecules. Macromolecules are the following kasi they contain energy. So guys, ang alak guys, may energy yan syempre. Okay? May energy ang alak, so it's still a macromolecule. Okay? By definition. Now, carbs and protein both has 4 kilocalories per gram. Fat has 9 kilocalories per gram. And alcohol, guys, has 7 kilocalories per gram. So, guys, hinay-hinay lang sa alak minsan-minsan. Okay? So, per computation, guys, 1 gram times 4, 3 grams times 9, 4 times 4, and 2 times 7. Then you add them all up, you will have the value of 61 kilocalories. Hence, the answer to our question. Number 7, what specialized cell of the liver is responsible for vitamin A storage? It is your ito cells. So guys, hindi lang po copper cells ang important cell ng ating liver. Okay, you also have your ito cells or stellate cells, which serve as the major site of vitamin A storage in the body. And may isa pa siyang function, during disease, siya ang nag-trigger ng ating liver fibrosis. In contrast, okay, your oval cells are the ones that generate liver parenchyma kapag tinanggalan mo ng liver ang isang tao or pag meron kang damage na reversible. While your pit cells are the natural killer cells of your liver. Number 8. What is the most powerful naturally occurring antioxidant? It is your vitamin E, and its representative molecule is your alpha tocopherol. Guys, so all stereoisomers of tocopherols and tocotrienols are known as vitamin E as collective term. Okay? It serves as the most powerful naturally occurring antioxidant. Pero guys, dito what I would like you to know is that hindi lang po vitamin E ang ating antioxidant. We have your A's, vitamins, zinc, and selenium. Vitamin A, C, and E, zinc, selenium are micronutrients with antioxidant effects. Number 9, what mineral serves as cofactor of the enzyme responsible for the cross-linking of tropocollagen? So guys, I've mentioned this concept a few moments ago. Diba? The enzyme involved here is your lysyl oxidase, the one forming cross-links between tropocollagen to form your mature collagen fiber. And the cofactor for this is your copper. Okay, so guys, dito copper is important for the cross-linking step. So in patients such as those with Menkes disease, wherein copper is not mobilized from the intestine, so it only stays in the intestine, hindi umabot sa liver, hindi umabot sa ibang parts ng katawan natin. Therefore, you have overall decreased copper in the body. It can lead to the features of Menkes disease, having neurologic degeneration and even having a kinky or steely hair. So it means meron kang impairment in your collagen formation. Pangit siya, it's defective. Kaya you have kinky or steely hair in the process. Number 10, what eicosanoid or arachidonic acid derivative inhibits neutrophil adhesion and chemotaxis? So, as mentioned, arachidonic derivatives are important in inflammation. So, all of these are pro-inflammatory except for your C, lipoxin. It inhibits inflammation. Okay? So, eicosanoids are derived from the 20-carbon fatty acid, arachidonic acid. So, we have your two main branches, the cyclooxygenase pathway and the lipoxygenase pathway. Under cyclooxygenase, we have your prostacyclin, thromboxane A2, and your prostaglandins. Ang ating prostacyclin is a powerful vasodilator and it inhibits platelet aggregation. Pero ang kanyang kalaban, ang kanyang natural enemy is si thromboxane A2. Magkalaban sila kasi si thromboxane A2 naman ay strong na vasoconstrictor and it promotes platelet aggregation. Now, your prostaglandins in general are very important for inflammation. Your PGE2 is responsible for fever induction while your PGD2, D2 ka pumunta. D2, it promotes chemotaxis, di ba? Chemotaxis is attraction, okay? Pinapapunta niya D2 yung mga neutrophils sa site of inflammation. So, take note of these concepts for your prostaglandins. Now, for your lipoxygenase pathway, we have your leukotrienes. Okay? Pero hindi sila pare-pareho lahat. Merong add man out. Si C4, D4 tsaka E4, ay for bronchospasm and increase in vascular permeability. They're very important in asthma. However, ang ating leukotriene B4, it functions as a chemotactic agent. Wala siyang bronchospasm, wala siyang increase in vascular permeability. And last but not the least, we have here your lipoxins, which are anti-inflammatory in nature kasi they inhibit chemotaxis and they inhibit neutrophil adhesion, delaying your inflammation in the process. 11. Which substance can directly inhibit the ATP synthase of the ETC? It's your oligomycin. So guys, this is a very testable question since first year med. Okay? Ano ba yung mga substances that can inhibit your oxidative phosphorylation? The ETC is a very important step in formation of your ATP. So, ang ating oligomycin, it inhibits your complex 5 inhibitor. Complex 5 is also known as your ATP synthase. Now, for the other complexes, we have the following drugs and some mnemonics na rin. Okay? Your retinon 1 inhibits your complex 1. Your antrimycin inhibits complex 3. Okay? Yung mga may ides sa dulo, mga ides natin, cyanide, carbon monoxide, azides, okay? They inhibit your complex 4. Ides has 4 letters. Now, we also have here your uncoupling agents. So, Ang nangyayari dyan dito, ATP synthesis stops, pero the electron transport continues. So with that, you will have a heat production in the process. So it is usually seen when you have here 2,4-dinitrophenol toxicity, aspirin overdose, and even thermogenin. Thermogenin is an important inducer of your brown fat lipolysis. Brown fat is usually seen in lower mammals. So ginagamit to para hindi sila ginawin. So ang ginangyayari, the brown fat is being destroyed to generate heat in the process. So nangyari, you don't form ATP when thermogenin is activated, but heat is produced rather. So it saves energy. At the same time, nagkakaroon ka ng heat production. Kaya maganda siya sa mga baby animals na wala pang enough na fur. Pero for humans, okay, it is actually dangerous. Okay, it can destroy the oxidative phosphorylation of our body. Number 12, okay, a testable question back then, siguro mga 3 years ago for biochemistry and nutrition. Guys, take note hindi lang po biochem ang ating topic dito, it's also nutrition. So according to the survey back in 2015, the typical Filipino diet consists of, wait, ano sabi nyo guys? Fish, fruits, and bread. Guys, that's Mediterranean diet, okay? So it's actually fish, vegetables, and rice. This is the correct answer according to survey. So survey says, letter A. So guys, pro tips guys for the NNS parameters. So this was asked back then. So ang pinaka kinakain ng mga Pilipino ay rice, obviously guys. At ang favorite time daw natin for consumption is snack time. Sobrang Pinoy nga talaga nito. So guys, take note of these important concepts. The most common cause of anemia globally and in the Philippines is iron, and iron is the most prevalent micronutrient deficiency in the Philippines. Number 13. What is the rate-determining enzyme of the HMP, your hexose monophosphate shunt? It's your AG6PD. So your rate-determining enzymes is a very testable concept for the PLE. Okay, it can ask 1 to 2 questions, but still, it's a question of 1 point na mahalaga. So you should at least familiarize yourself with this table. But what I like to tell you about this concept is that rate determining step is the slowest step in a metabolic pathway. Ano ba yan? So think of a group of friends na pumunta sa Spartan race. Diba? If you attend the Spartan race, then you enter the group category. With your friends, of course, walang iwanan. Kahit na sobrang bilis mo, pero you have the slowest member, you can't leave your friend behind. So your friend is the rate determining enzyme. It determines the rate of the whole metabolic pathway. So dahil yan ang ating slowest pathway, slowest step in the pathway, siya naging point of control for different metabolic pathways. So the effectors will affect this enzyme if you will have a speed or increase in the rate of the reaction, or some effectors may even slower. Pinapabagal niya yung ating metabolic reaction. So that's the point of control per metabolic pathway. The slowest step or the rate determining enzyme. So guys, this is for your memorization in the future. Okay? 14. So we'll encounter here vitamin deficiencies and vitamin toxicities. Very testable concept. So this vitamin, when in toxic amounts, can cause an increased risk for podagra. Podagra, okay, it is the formation of a gouty arthritis of your first MTP of your feet. Okay, it's associated with niacin toxicity. Okay? Now, funny thing, ang kabaligtaran ng podagra ay pellagra. Pellagra is niacin deficiency naman. Okay? So, here are some vitamin B toxicities. So, your B3, your niacin, in toxic amounts can also cause hepatotoxicity, the most serious toxic reaction of this type of vitamin B toxicity, and facial flushing. While your vitamin B6 naman, in excess amounts, can cause sensory neuropathy. Pero wait, Doc, bakit konti lang ang ating vitamin B toxicities? Kasi vitamin B is a water-soluble vitamin. Therefore, it is not stored in the body for long amounts of time. Nasa aqueous compartment siya most of the time. So, if aqueous compartment ka, it means pwede mo siya maihi everyday. Therefore, toxicity from vitamin B and vitamin C are actually seldom or very rare in occurrence. Okay? 15. What is the correct order of the repetitive four-step process of fatty acid synthesis? It's your C, condensation, reduction, dehydration, and reduction. Now, what is naman your fatty acid degradation? It's letter A. Diyan naman siya. So, this is more of memorization, I know, but you have some tips here, guys. Check your terminologies here. Reduction is always involved in, almost always, in anabolism. Anabolism is when you synthesize something, when you form a very big structure out of smaller parts. Okay? Take note of that. Tapos when you hear the terms lysis, mga lysis, lysis is associated with what? With catabolism. Okay, kung saan, for example, a large protein is being degraded into smaller amino acids. That's catabolism. So from that pa lang, you can have naman an idea na if it's synthesis, baka yung C or D. Kasi you have reduction in the questions. However, at least dito, buwaba na yung iyong chance na makatama. It's now 50%, just C or D na lang, diba? So with that said, mamimili ka na lang if di mo siya talaga alam, C ba or D. So that's one of the testmanship concepts that I would like you to understand. Know the meaning of the terms in the questions, okay? And when you're studying. Because etymology, okay, the origin of the words would help you along in the medicine board exam. Now, more pro tips, guys, are the eponyms of the metabolic pathways. Minsan, ang nangyayari, they won't tell you the common name. They'll give you the eponym. So, magugulat ka, ano yung ating Embden-Meyerhof pathway? Huwag kabahan, it's only your glycolysis. What's the Cori cycle? Huwag kabahan, it's only your lactic acid cycle. So, have an overview of these eponyms. Familiarize yourself with these terms, okay? Not only in biochem, but also in other subjects. Number 16, which blotting procedure is used to detect DNA binding proteins? Okay? The correct answer is the southwestern blot. So we have a mnemonic here, snowdrop. Okay? Southern blot for DNA blot, northern blot for RNA detection, and western blot for protein detection. Pero guys, ang tanong ay DNA binding proteins. So DNA, southern, western proteins. So your southwestern blot detects your DNA binding proteins. Guys, it's not a joke. Totoo yan. Okay? So, it means you also have your northwestern blot, which detects RNA and protein reactions. So, take note of this concept for biochemistry. Number 17. A 27-year-old female started on a diet fad of excessive ingestion of raw egg whites with hopes of having a healthy and brilliant skin. However, after 3 months into this diet, she developed dermatitis, alopecia, and grayish skin. Mas pumangat pa lalo. So what vitamin deficiency is involved in this case? But first, let's define the more scientific names of these vitamins. Biotin is your vitamin B7 or vitamin H. Pantothenic acid is your B5. Pantothenic, pento, 5, diba? Pyridoxine is B6, while niacin is your B3. Among them, biotin is the correct answer. So we'll have here biotin deficiency. Doc, bakit? Because your raw egg whites and even antibiotics, some of them, has large amounts of avidin. Avidin, ang nangyari dyan, they avidly bind to biotin in the intestinal lumen. Therefore, you cannot appropriately absorb biotin kasi si avidin ay nakadikit sa kanya. Therefore, you will have biotin deficiency in the process. 18. What vitamin is virtually absent in human breast milk? It's your vitamin K. Now, samples lang guys, vitamin D, medyo konti din daw, sabi ni Williams. Okay, so in the US, I think some practitioners are even given vitamin D supplementation. But in the Philippines, only vitamin K administrations being done kasi it can cause bleeding, diathesis in the infants because the infants have a higher risk for vitamin K deficiency. One, neonates have low fat stores. Take note that vitamin K is an ADEC vitamin. ADEC vitamin are fat-soluble vitamins. Therefore, they're better stored in the body if meron kang fat. Ang mga neonates ay mostly water in concentration pa, habang baby pa. Tapos ang mga neonates mo, they lack intestinal flora. Much of our vitamin K are derived from intestinal flora. Tapos, as mentioned a while ago, vitamin K is absent in breast milk. So, talagang wala kang supply for vitamin K in the neonate. Therefore, vitamin K is being provided, okay, during, after delivery rather. 19, which phospholipid is primarily found at the outer leaflet? Guys ang tanong ay primarily found, meaning doon siya mas makikita mismo. Okay, at the outer leaflet of the cell membrane, it's your phosphatidylcholine. So, take note of this concept. Okay, the cell membrane has 2 leaflets, diba? Kaya siya ganito, guys. Okay, kaya siya ganyan kasi these are actually 2 leaflet. Okay, an outer leaflet and an inner leaflet. Now, the inner leaflet, the one inside, are your inositol, serine, and ethanolamine. Okay? Ang nasa labas naman, ang ating choline and sphingomyelin. So, for some pearls on phospholipids, choline ang ating most abundant, followed by ethanolamine. Now, ang ating phosphatidylserine, as mentioned, it is mainly found in the inside, in the inner leaflet. But, during apoptosis, serine becomes an outer leaflet na phospholipid. Kasi it wants to signal apoptosis. It tells the cells na, guys, I want na die. Okay, so kainin nyo na ako. Yun ang ibig sabihin niya. Kaya lumalabas si serine from the inner leaflet going to the outer leaflet. But, primarily, it is still found at the inner leaflet. Hence, the best answer is still your phosphatidylcholine. Okay? Inositol naman, it's the reservoir for your arachidonic acid, a source of ITP and DAG. Okay, they're very important for your signal transduction. And cardiolipin naman is very antigenic and useful for syphilis detection. 20. Which is a salient feature of the Watson-Crick model of the DNA. The correct answer here is the 2 strands of DNA are anti-parallel. Kasi 1, mali ang ating A. It should be right-handed. Okay, I'll discuss this in a few slides. Tapos B, laging mas lakas ang ating guanine and cytosine bonding, di ba? Sabi ko nga, GC couples are stronger together. Okay? Tapos, the number of purines and number of pyrimidines are always equal according to your Chargaff's rule. So, some important features of your Watson-Crick model, dapat right-handed siya. So, paano yan? It means, when you look at the axis of the DNA, division, usual DNA convertation, di ba? Pero when you look at this point, dapat right-handed or clockwise yung kanyang rotation. So, yun yung ating part ng ating DNA model for Watson and Crick. Tapos, as mentioned earlier, your base pairing rule and hydrogen bonding rule. And the 2 strands should be anti-parallel. And lastly, by Chargaff's rule, the number of purines must equal your number of pyrimidines. Okay? So that's all for your biochemistry. Now we head to your anatomy and histology. Okay? Konti break na muna if bigla kayo na bigla, but I hope you're still there, guys. Kayang-kaya niyo yan. Natuwala lang, ha? So, 21. In the spleen, T cells are mostly found in the structure. The correct answer is your periarteriolar lymphoid sheath. Guys, the question here is in the spleen. Baka sagot niya ay paracortex. Tama ka if ang tanong ay lymph nodes. So, here are the locations of your different cells, immune cells. Okay, papag-usapan ang ating mga lymphoid organs. Pag lymph node, ang T cells ay nasa paracortex B cells are in the follicles, macrophages are in the medullary sinuses, while plasma cells are in the medullary cords. Pero pag spleen ang usapan, iba ang ating mga terms na ginagamit. Okay? Pulse for the T cells, white pulp for the B cells, and sa mga sheet natin, andyan ang ating mga macrophages. 22. Birbeck granules are tennis racket structures specific to your Langerhans cells. So, it means during your disease na Langerhans histiocytosis, ang hinahanap mo ay mga cells na merong Birbeck granules. So, mga silang tennis-shaped na rackets. So, guys, dito I have compiled here famous or more very important na testable na histologic hallmarks. So, guys, for the board review, guys, balik-balikan nyo ng konti to. Okay, for some review. Okay? 23. Okay, guys, this is a very important anatomy question. Okay, lagi matanong yan for the PLE. The nasolacrimal duct drains into the inferior meatus of the nasal cavity. So guys, dito, very important yung mga innervation, mga sites of drainage, yung mga arteries natin and veins, okay? And usually guys, yung Snell na reviewer, very helpful yan kasi they have tables there for your review. And Snell is usually a basis for some questions. So dito guys, makita nyo yung mga sites of drainage ng ating mga sinuses going into the nose. 24. Which cranial nerve is located at the middle compartment of the cavernous sinus? Okay, the correct answer is your A. Abducens nerve, also known as your cranial nerve 6. As you can see here guys, the cavernous sinus has two major compartments. A lateral compartment and a medial compartment. So kung makita nyo dito guys, siya ang odd man out. So, in making questions, odd-man-out questions are very popular kasi they're very easy to be asked, di ba? Kasi they're very testable. So, madali siyang matanong in the exam. So, take note of odd-man-outs when you're studying. So, that's the tip here in anatomy. Maraming mga odd-man-outs, so take note of these concepts. 25. What is the innervation of your tensor veli palatini muscle? It's your nerve to medial pterygoid from the mandibular nerve. As mentioned, odd-man-outs and generalities are important. Okay, ito guys, I've compiled here the generalities for the innervation of your head and neck muscles. All intrinsic muscles of the larynx are innervated by the recurrent laryngeal nerve except the cricothyroid kasi it's being innervated by the external laryngeal nerve. Same with your tongue muscles. Mainly, ang nag-innervate sa kanila ay hypoglossal nerve, except for the palatoglossus. Kasi sa kanya, ang nag-innervate ang ating cranial nerve 10 via the pharyngeal plexus. And lastly, all muscles of the pharynx are innervated by the pharyngeal plexus, except the stylopharyngeus, kasi it's being innervated by your glossopharyngeal nerve. 26. The moderator band of the heart is found in this chamber. It's found in the right ventricle. So the moderator band is a type or form of trabecular cornea, the type of muscle found in the ventricle. And it conveys the right branch of the atrioventricular bundle of your heart conduction pathway. It's very prominent. Okay, ang ating left branch hindi siya visible sa ating left ventricle. Kasi mainly, the left ventricle is very makapal. So, hindi siya super kita. Unlike in your right ventricle, since ang kanyang pressure going to the heart is very minimal lang, konti lang yung kanyang function masyado in terms of pumping. So, medyo manipis siya when compared to your left ventricle. Kasi konti lang yung kanyang work capacity. So, mas prominent dyan yung ating mga bundle structures. And one of them is your moderator band, very unique to your right ventricle. 27. This structure is mostly located at the apex of the triangle of Koch. Okay? So guys, this concept is very important for electrophysiologists kasi you want to know where to ablate the different nodes of your heart. Kasi especially if you want to perform some procedures such as correction of your AV blocks, etc. So the triangle of Koch represents your atrioventricular node. So yan ang ating mga boundaries, okay? The tricuspid valve, so you can see here, okay, the orifice of your coronaris sinus, and the extension of the eustachian valve of the IVC, known as the tendon of Todaro. So sa apex niya, most likely nandyan ang ating AV node. So that's the rationale why you must know this anatomic concept. 28. Which artery is a branch of the anterior division of the internal iliac artery? Okay, so guys, you have to know the branches of the arteries. Okay, so there are trends lately, mas madalas sila matanong. The arteries involve the lymphatic drainage, the venous drainage, and even the innervations of your muscles and some actions. So dito guys, or uterine artery, okay, is the branch of your anterior division. Kasi, ayan, it's part of it, diba? Ang posterior division mo kasi, konti lang sila. So, how do you attack that? Ang dami. So, only memorize yung mga mas konti. Ako, I will only memorize here guys, the posterior division, the ILS. I love sex. Okay, so these are your arteries from the posterior division of your internal iliac artery. Mas madaling tandaan sila. Your iliolumbar artery, lateral sacral, and your superior gluteal artery. Okay? Take note of these concepts and study tip on how to memorize large amounts of data. Number 29. Which gluteal muscle is innervated by the inferior gluteal nerve? It's your gluteus maximus. Okay, so guys, find trends in innervation as well. Dito, makita mo, pag superior, medius minimus saka tensor fascia latae. Pero ang inferior, only ang ating gluteus maximus. So it's already something. Siya ang tinatawag na odd man out. Siya ang ating piriformis, kakaiba siya. Only for sacral nerves 1 and 2. Pero mag-plexus ang usapan, the rest of the muscles already. So that is how you memorize your muscles for innervation. Try to group them together. Okay, make a table out of them para mas madalian kayo in the process. 30. Which is not a rotator cuff muscle. It's your minor? No. It's actually your teres major. So guys, medyo confusing to concept kasi sabi niya minor, so baka hindi siya kasama sa grupo. While in fact, siya ang kasama sa ating seats mnemonic. Supraspinatus, infraspinatus, teres minor, and subscapularis. So, anatomy guys, most is really heavy memorization. Okay? And take note guys na ang ating inferior part of the glenohumeral joint is the weakest part. As you can see in the image guys, siya ang merong konting muscle involvement here. And if we lack muscles in some areas of the joint, mas mahina siya. So, prone to dislocation ang ating glenohumeral joint. Mainly sa ating weakest part sa inferior part ng kanyang structure. 31. Which rectus muscle of the eye inserts nearest to the limbus? Okay? According to the spiral of Tilaux, it's the medial rectus muscle. So, in spiral na yan, as you can see here guys, it's very important for your strabismus surgery sa mga bata. As you can see, 5.5 millimeters lang ang ating distance ng ating middle rectus to the limbus of the cornea. In contrast, pinakamalayo ang ating superior rectus around 7.7. So, para siyang paikot. Medial, inferior, lateral, and superior. Palayo siya. As you go from middle rectus, going to superior rectus. Hence, ang pinakamalayo naman to our limbus is our superior rectus tendon. 32. Which structure arises within the triangle of Callot? Guys, ang tanong dito ay structure arising within the triangle, not that boundary of the triangle. Therefore, the correct answer is the cystic artery because the rest are the boundaries of your triangle of Callot. So, first boundary, the surface of the liver. Second boundary, the common hepatic duct. Third boundary is your cystic duct. Tapos yung structure sa gitna niya, within it, is your cystic artery. So this triangle is useful for detection of your cystic artery during surgery of your gallbladder para maiwasan sila in the process. Okay? So take note of this concept in anatomy and surgery if hindi matanong sa anatomy. 33. The retina is a derivative of this structure. It is your diencephalon. So here's the figure showing the regional specification of the developing brain. Sa una, you will only have one neural tube. Eventually, it will form into 3 primary vesicles. The forebrain or prosencephalon, mesencephalon, and rhombencephalon. A few days later, they will now become 5 secondary vesicles. Ang prosencephalon mo or the forebrain becomes the telencephalon and diencephalon, while the midbrain still becomes your mesencephalon, while the hindbrain or rhombencephalon now becomes your metencephalon and myelencephalon. The diencephalon will now become your thalamus, hypothalamus, and siya ang ating origin ng ating retina. So take note of this concept. As well as the cavities associated with our different primary and secondary vesicles. They're very testable for embryology and it's still part of your anatomy. If not asked here, it can still be asked in pediatrics. 34. What is the correct order of structures that the needle passes through to access the epidural space? It's letter D, skin, fascia and fat, supraspinous ligament, interspinous ligament, ligamentum flavum, and the epidural space. So guys, it's a very important concept. Okay, it can be asked in anesthesiology and surgery. So dyan, skin muna, fascia and fat, then tatama sa ating supraspinous ligament. It makes sense, diba? Kasi it's found at the superior aspect, okay, of our vertebral structures, diba? Tapos, next ang ating interspinous ligament, then finally the ligamentum flavum. So pag gusto mong ma-access ang ating epidural space, you stop at that area for anesthesia. But if you want to collect CSF, you must go beyond it. So you'll pass through the epidural space, then you'll now pass the dura mater, going to the arachnoid mater. Because the subarachnoid space is found sa ilalim ng ating arachnoid mater, deeper than the arachnoid mater. So you stop the needle at the subarachnoid space. So some concepts, guys, for complications. A dreadful complication of anesthesia and CSF collection is having an intraspinal hematoma. So guys, ingat-ingat ha, huwag maging aggressive kapag ginagawa ang mga procedure na to in moonlighting and beyond. 35. A 35-year-old male had a fracture of the surgical neck of the humerus when he was hit by a crowbar by an unidentified assailant. So what neurovascular structure is expected to be damaged? It's your axillary nerve. Guys, this is very easy, okay? Arm, ARM. The A axillary nerve, radial nerve, and the medial nerve. Ang upper one-third ng ating arm, okay, is the surgical neck of the humerus. The mid-shaft is the middle one-third, and the distal humerus or the cubital fossa has the median nerve. Now, sa nerve lang yan. Ang tricky part dyan ng konti is the artery. You have to memorize them ng konti. So, for the upper one-third, we have the posterior circumflex artery. Now, for the middle one-third, we have the deep brachial artery. And lastly, we have the brachial artery for the lower one-third of the upper arm. 36. What is the dermatome seen at the level of the xiphoid process? It's your T7. So, the name one here, guys, is xiphoid has 7 letters. So, guys, more tips here. C2, para sa posterior half of the skull and angle of the jaw. Kasi the angle of the jaw, hindi siya part ng V3 natin. Okay? C2 na ang nag-handle ng ating angle of the jaw. Beyond this, dito, V3 na yan. Pero pag ang angle of the jaw ang usapan is part of your cervical 2. Thumb, 6. Kasi thumb looks like a 6. Okay? At the nipple level, okay, think of a teeth pore. Pore, 4. Umbilicus, belly button, 10. Okay, at the inguinal ligament. Okay, ligament L, inguinal, I looks like 1. L4, kneecaps. Okay, down on all fours. Okay, and lastly, the penile and anal zones have your S2, S3, and S4. These are important landmark dermatomes. Kasi halos impossible memorize mo lahat yan dito. Okay, you should have landmarks along the way. Okay, especially in neuro. 37. Melanocytes are primarily found at the stratum basale. Okay? So besides your stratum basale having your melanocytes, you also have usually you have your Merkel cells and even your basal cells. Okay? Sila yung mga stem cells natin for your keratinocytes. Pero ang ating mga special cells such as your Langerhans cells, Langerhans is usually found at the level of the stratum spinosum. So guys, don't forget your histology, ha? You still have to study them. Paiba-iba ang time, usually 5 items lang, minsan 10 items. But still, these are large amounts that can be asked in the PLE. So take note of these questions. 38. Bennett fracture is a fracture of the first metacarpal of the hand. Okay? So some pearls for injuries to the bones of the hand. The most fractured carpal bone is the scaphoid. The most dislocated is the dislunate. Okay, the lunate bone. Pag ang usapan ay Bennett fracture, first metacarpal. Pero pag boxer fracture is the fifth metacarpal bone. Okay? Pearls for your injuries to the bones of the hand. 39. Nutcracker syndrome is a vein compression disorder wherein the left renal vein is squeezed between the abdominal aorta and the superior mesenteric artery. So as you can see guys dito, okay, the left renal vein, yung blue structure, naipit siya ng ating aorta at ng ating superior mesenteric artery. Okay, kasi this is the celiac artery. Celiac yan. Ito ang ating IMA. Dahil dyan, pwede ka magkaroon ng left-sided flank pain and gross hematuria. So, it's a very important disease entity. Okay, especially in your nephrology and even in surgery. Your nutcracker syndrome. And last but not the least, for number 40, which is not, okay guys, not a normal constriction of the ureters. So, normal ang ating constriction sa ating urinary bladder passage, sa junction ng ureter saka ng renal pelvis, saka kapag dumadaan ng ating ureter sa ating pelvic brim. Wala tayong constriction sa ating uterine arteries. Okay? Guys, pati of the uterine artery, these are very important concepts. You must know them and they can be asked in obstetrics. Okay? In a previous board exam, natanong yung pathway ng ureters natin. So, you should have a little mastery about them. So, here is this guide for the some landmarks. Pero take note guys, hindi po constriction ng ating running under the uterine artery. Okay? So, dito guys, ang tamang term natin dito ay water under the bridge. Okay? Kasi water is the urine, di ba? It's the ureter. So, it's a very important concept na alam mo na dumadaan ang ating ureter under the uterine artery. Kasi during tabiso, sa mga obstetrics dyan, nagpaplano, dapat maiwasan ng ating ureteral damage. Kasi baka kailangan mo mag-refer sa ating urologist kasi nagkaroon ka ng leakage of urine. So guys, ingat along the way. Okay? So that is our last question for anatomy and histology. Now, we go to one of my favorite topics in medicine and in public health. And I will also be a lecturer here for your mycology and parasitology. So we now head to this part of the exam, microbio and parasitology. Okay. 41. A 36-year-old female having intermittent itching of her wrist, breast, and buttocks. Upon PE, burrows were found at the interdigitations. What is the drug of choice recommended for treating the most likely condition of the patient? So guys, dito guys, tinan nyo ang usapan na. Wrist, breast, and buttocks. Okay, these are actually intertriginous areas. Tapos you have burrows na nakita. So it's very specific of a certain condition known as your scabies, di ba? So the burrowing can be found mainly at the interdigitations natin sa kamay natin. So the scabies is being caused by your Sarcoptes cabillae var hominis. And the most likely and the best treatment here is actually using a permethrin agent. So guys, let's differentiate the two, pediculus pubis and scabies. Scabies is the great dermatologic imitator. Okay, pwede siya magmukhang, in some degree, pwede siya magmukhang psoriasis in some patients. Ang ating pediculosis pubis naman, siya, lagi lang siyang sa ating pubic hair. Okay? Tapos hindi siya widespread, mas localized siya. While the scabies naman is widespread, but no hair predilection. In terms of clinical assessment, there are needs, okay, sa ating mga pediculosis pubis, sa mga kuto natin, ha. Guys, kuto yan ng ating genital area, okay, to be specific. But both of them, ang drug of choice are permethrin cream. Kaso, mas matagal ang ating duration of treatment for scabies. Kailangan around 8 to 14 hours kang babad sa permethrin cream, and dapat hindi lang ikaw, pati mga roommates mo, saka family members mo. Okay? And dapat body from neck down. Ganun siya katagal tinitreat. Okay? Kasi nakakahawa ng scabies na sakit. Okay? So guys, if nangangati ka, ingat lang ha, baka hopefully wala kang scabies dapat. 42. A 34-year-old male hiker having excessive flatus and chronic diarrhea of rotten egg smelling and steatoreic stools. So, nagpa-fecalysis ka, may nakita kang falling leaf motility. What is or are the diagnostic stages of the agent causing the most probable condition? So, guys, in attacking cases, always find the different clinical presentation of features, okay? First, you rely on epidemiology. Hiker. Okay, young male na hiker. So, pero hiker mas dyan inisip mo. After epidemiology, now lead to your clinical presentation. You have here, steatoreic stools, chronic diarrhea, rotten egg smelling. So, doon pala, meron ka ng idea kung ano yung possible na sakit ng ating pasyente. Tapos, sinabihan ka pa ng falling leaf motility. Okay, the diagnostic feature. So, that clinches the diagnosis actually. Kahit di mo alam yung first two na epidemiologic siya, clinical presentation, pero alam mo yung diagnostic na criterion, meron ka ng idea already. So, in terms of hierarchy, diagnostic muna ang papansinin. Pag wala, look at the clinical presentation. Pag wala, look at the epidemiology. Okay? So dito, mukhang meron kang giardiasis being caused by your Giardia duodenale or Giardia lamblia. Ayun, tinan mo, para siyang falling leaf motility. Parang dahon na nahuhulog. Diba? Pag nanonood ka ng anime, pag nanonood ka ng mga movies na madrama, diba? May mga dahon na daan-daan bumabagsak. So, yun guys. And the most probable na sakit dyan ay giardiasis. Okay, causing here chronic diarrhea. Dito, ang stages na diagnostic, meaning ito yung stage in the life cycle of Giardia na makikita mo sa diagnostic tool mo, which is, in this case, is direct microscopy. The correct answer is both A and B. Both of them are diagnostic stages. And you can see the cyst and the old man face looking trophozoite. Okay? Pero ang infective stage niya ay ang cyst lang natin. Okay? Dito, ang trophozoite niya has 2 nuclei, pero ang cyst niya ay mga 4 nuclei. Tapos, you can have here steatorrhea and rotten egg odor, mainly in chronic diarrhea states. Tapos, usually, for epidemiology, nakita siya sa mga hikers, saka sa mga bata sa mga daycare centers. So, yan yung mga clincher natin na features for your epidemiology. 43. What is the agent causing your GAE or granulomatous amoebic encephalitis? It's your A, Acanthamoeba. Okay? So, these organisms are what you known as your free-living amoeba. Ang Acanthamoeba sa ang ating Naegleria fowleri. Okay, they enter the body via different processes. Pwedeng sa ating nasal passages, pwedeng via sa ating eyes or some skin ulcerations. So in the end, ang ating Acanthamoeba can cause GAE, and even the very famous acanthamoeba keratitis, di ba? I think nababasa yan sa mga some journals and sa ating mga some memes sa FB before na kapag hindi ka naglinis ng iyong eye contact lenses, pwede ka magkaroon ng acanthamoeba keratitis. So, kailangan lagi siyang malinis, guys. Daw, Naegleria fowleri naman, this can cause your primary amoebic meningoencephalitis. Pero Doc, meron tayo secondary amoebic meningoencephalitis. Tama ka dyan. It's being caused by your E. histolytica. Doc, bakit secondary? Kasi it's only a secondary form of infection. Kasi una, ang ating E. histolytica, lagi siyang intestinal infection muna. Pero pwede siya magkaroon ng mga extra-intestinal manifestations. And the most common extra-intestinal manifestation of your E. histolytica infection is your liver abscess formation. Pero minsan, hindi nasasalo ng liver na mabuti ang ating amoeba na E. histolytica. Pwede siyang pumunta sa ating CNS and can cause secondary meningoencephalitis, presenting as a secondary form of E. histolytica infection. 44. A 10-year-old male having serpiginous rash. Okay? And sabi sa history niya, he is fond of playing on sandy soil, barefooted. What is the agent causing the condition of the patient? So, sandy soil, think of possibly a hookworm infection. Kasi doon sila usually naglalay ng mga eggs. Tapos, meron kang serpiginous rash. Tanong, ano kayang hookworm na nagkukos ito? So, serpiginous rash siya. Para siyang ganyan, di ba? Ang tawag dyan ay cutaneous larva migrans. So, ang tamang masagot dyan ay no, mali, not your A and B. The correct answer is your C, Ancylostoma brasiliense, a type of animal hookworm. Dok, bakit? Ba't ganyan? Kasi guys, ganito yan. Your animal hookworms, brasiliense and caninum, they are not specific to man. Therefore, kapag pumunta ang larva natin, sa ating paa, via skin penetration, they cannot penetrate the blood vessels kasi ang kailangan nilang puntahan ay hayop, dog or cats. So, nangyayari, they are retained sa ating subcutaneous layer ng skin natin. And they present here as serpiginous rash. Therefore, it's only a local infection. Never ka makakita ng CLM na ang cause ay Americanus saka A. duodenale. Ang mangyari sa mga larvae nito, they will go to the bloodstream afterwards, going to the intestine to become mature worms afterwards. Ang tawag sa lesion ng ating Negator americanus saka A. duodenale, representing as skin penetration entry ay ground itch. Okay, wala silang cutaneous larva migrans. It's only specific to your animal hookworms. Okay, this is a usual medical confusion among medical students. So, please correct this already at this point. Okay? Samples, guys, most common human hookworm in the Philippines is your N. americanus. My mnemonic here, tayo ay na-invade ng America. So, we are mainly Americanized. So, siya ang ating most common na human hookworm. But between the two, mas nagkakos ng blood loss ang ating duodenale. Kasi meron siyang 2 pairs of cutting na ngipin na sharp, di ba? In contrast to your N. americanus, you only have your 1 pair of cutting plates. So, mas mataas ang blood loss sa ating A. duodenale. Therefore, mas mataas ang risk for having iron deficiency anemia. 45. A 36-year-old male is coughing for more than 8 weeks with hemoptysis. So, 8 weeks na coughing. Sabi ni IM, ni Harrison, yan ay isang form of chronic cough. Okay? Ang tanong, TB kaya to? Baka pwede, di ba? Kaso, ang nangyari, nagpa-sputum ka at stool examination. May nakita kang itlog ng parasite. So, doon pala, baka hindi TB to. Ang kanyang itsura, meron siyang ab-opercular portion. Dok, ano ba ang ab-opercular portion na makapal? So, first, ano ba ang ating operculum? The operculum is the opening here. That's the opening of your egg. It's operculated. Now, ab-opercular, meaning sa contralateral side niya, counter to it, this is the ab-opercular side. At kung papansinin mo, medyo makapal siya ng konti, may konting thickening. Okay, not very visible here, but in some sides, may makapal talaga siya. This could be an egg of your Paragonimus westermani, a very famous TB mimicker. And ang kanyang second intermediate host ay ang ating very famous na Sundatelfusa philippina in the Philippines, which is actually a freshwater crab. Hence the answer. So, paano bang life cycle niya? Ang nangyayari, the egg released to the water becomes your merasidium. Tapos maghanap siya ng snail known as the antimelania. And they will serve as your first intermediate host. Again guys, okay, more on my lecture next time, pero the intermediate host contains the larval or asexual stages of your parasite. After going to the antimelania, they will be released back to the water as cercaria. And the cercaria will hunt down freshwater crabs or crayfishes. Sa Pilipinas, ang pinaka-most predominant na crab na affected ay ang ating Sundatelfusa philippina. Tapos magsistay siya sa body ng ating crabs until makain siya ng isang definitive host. So usually mammals ang kumakain ng mga crabs na yan. So pag nakain mo yung metacercaria niya, which serves as the infective stage of Paragonimus, magkakaroon ka ng Paragonomyces. Ang kanyang usual presentation ay para siyang PTB mimicker. Okay, nag-stay kasi siya sa ating lungs. It's a lung fluke eh. Lung fluke infection. So you will have chronic TB, chronic cough rather, hemoptysis kasi sira yung ating lung parenchyma dahil sa deposition of eggs sa ating lungs. Dok, bakit nagkakaroon ng egg din sa ating pupu? Kasi some of the sputum ay nalulunok natin. So in the end, tinatayo mo rin siya in the process. So that's the life cycle of your Paragonimus westermani. 46. What is the reservoir host of the largest protozoan infecting man? Ano ba yan? It's actually your Balantidium coli. Okay? And it's also the only medically important ciliate. Ang kanyang reservoir host ay mga baboy, mga pigs. So, in studying parasitology, you should also know your reservoir hosts. Okay? Your P. westermani for the field rats, Brugia malayi, mga cats, and your E. histolytica for humans. Now, ito naman guys, some important hosts sa ating some organisms, guys. Legionella can be seen daw in Acanthamoeba species, and some Dientamoeba fragilis are actually seen in Enterobius vermicularis, according to your Belisario book. So take note of these concepts for parasitology. 47. Heparlobatum is caused by what organism? Heparlobatum is an acquired hepatic architecture distortion due to contracted scar tissue from healed gummas. Gummas, guys. Gummas is actually seen in your tertiary syphilis. The correct answer in this case. So, these are your different types of tertiary syphilis. You have your neurosyphilis, iritis, and your gamma formation. And kapag ang ating Treponema pallidum ay nagstay sa ating liver, magkakagama ka dyan, tapos pag nag-contract siya ng scar formation, masisira yung kanyang liver parenchyma. It will now becomes your heparlobatum. 48. Which condition is not a sexually transmitted disease? Meaning, hindi siya nakahawa through sex. Okay, it's your bacterial vaginosis. Pero, it is actually a sexual-related disease kasi sexual intercourse can actually modify the flora of your vagina. Of your vagina rather, para sa mga babae. When that happens, nagkakaroon ka ng predominance of your mixed flora. Instead na lactobacillus siya, mas nagiging Gardnerella vaginalis. So this is actually a normal flora na biglang dumami. So hindi siya sexually transmitted disease. It's only a sexual-related disease. Your bacterial vaginosis or back vag. 49. What is the most common sexually transmitted disease worldwide? It's your HPV infection. Okay. Samples for the STD according to Jowett's and your Lentz Comprehensive Gynecology. As seen here guys, HPV is the most common STD. Siya rin ang pinaka-most common na viral infection of the genital tract. The most common bacterial STI is chlamydia. The most contagious is pediculosis pubis according to your Lens Gynecology. Nakasabi yun doon. The most common symptom in gynecology is vaginal discharge. And the most common serious infection of women in the young reproductive age is acute PID. 50. What strain of E. coli is seen in traverse diarrhea and persistent diarrhea among HIV patients? The correct answer is B, enteroaggregative E. coli. Now, E. coli has different strains, okay, according to Joetz. Enteroaggregative, guys, it's your HIV patients. Invasive E. coli, invasive ka na, invade mo yung mucosa mo. Therefore, may damage ka sa iyong capillaries, leading to bloody diarrhea. Enteropathogenic, okay, per epidemiology, seen in infants. Enterotoxigenic, the most common cause of traverse diarrhea. Dito, mayroon kang toxin na parang cholera-like yung ating presentation ng diarrhea niya. So, tayo ng watery. Wala kang dugo masyado kasi toxin-mediated siya, bale. So, walang destruction ng ating mucosa, kaya wala kang bahid ng dugo. Wala kang dysentery. Now, you also have your Shiga-producing strains. Ito ay specific for your hemorrhagic colitis that is also an increased factor for having hemolytic uremic syndrome. Mainly your O157H7 strain. And per epidemiology, ang kanyang usual na nakita sa mga exams ay its association with eating hamburgers because of a previous outbreak back then with hamburgers and mga deli meats. 51. What is the genomic structure of the agent causing the fifth disease? The fifth disease is more commonly known as your erythema infectiosum, known for having a slap-cheek appearance among children. And the agent causing that is your parvovirus B19. Okay. And this parvovirus B19 has a genome of a single-stranded DNA. So, you have to memorize the different schemes for DNA and RNA viruses. For this question, I'm only discussing your DNA viruses. Guys, your DNA viruses are very happy viruses. Hepadna, herpes, adeno, papilloma, polyoma, and parvoviruses. And your pox viruses. Dahil DNA virus ka, you have a predilection to the nucleus. Except for the pox virus. Kasi the pox virus is a very, very large virus. So, it stays sa cytoplasm most of the time. It is icosahedral in structure except for the pox virus. Ang pox virus, ang tawag sa structure niya ay complex na structure. All of them have double-stranded DNA except for your parvovirus. It's the only DNA virus na medically important na single-stranded in structure. Then all are having linear genomes except for papilloma, polyoma, okay, and the hepadna virus. 5.2. What is the single most important cause of endemic severe diarrhea in infants and young children worldwide? The correct answer is your rotaviruses, mainly your group A rotavirus. So guys, in this slide from Joetz, it's a very testable concept, ha? Pag ang number 1 sa mga bata, it's always rotavirus. Pero pag ang pangalawa, na most common, na important, it's your enteric adenoviruses. Pag matanda naman, ang pinaka-cause ng ating mga viral na diarrhea, yan ay kinukos ng ating mga noroviruses. Take note of these concepts for epidemiology of your gastroenteritis. 5.3. Which strain of influenza can cause both antigenic drifts and shifts? So, antigenic drifting, okay, is a feature of the orthomyxoviruses since these viruses are made up of 8 segments, allowing rapid genetic reassortment. Okay? So, ang ating mga influenza, every year, nagbabago yung kanilang strain. Kaya, yun ang rationale mo. Bakit? Meron kang annual vaccines. That is because of your antigenic drifting and shifting. Okay? This drift lang sila, parang minor lang siya ng antigenic changes. they can cause epidemics and are seen in all types of influenza. Influenza A, B, and C. Pero yung mga antigenic shifting natin, shift, di ba? Parang major siya na nangyayari na event. Hindi na siya drifting. It's a shift. It causes major antigenic changes. Okay, that can cause pandemics. And this is only seen in patients it's only seen in the type of influenza known as influenza type A. Only influenza A can cause antigenic shifting. Okay. Pero pag drifting ang usapan, all influenza can cause that. Therefore, the correct answer here is influenza A virus. You know guys, wala kang D kasi there's no such thing as an influenza D virus. Only A, B, and C. 54. Which viral family has the largest genome among the RNA viruses? It is your coronaviruses. So, besides what we've discussed earlier, okay, hindi lang enough yung ating number of genome structures para maging kang very prominent for having drifting and shifting or even rapid mutations. Dahil napakalaki ng ating genome ng ating mga coronaviruses, meron kang increased chance for mutations to occur. Kaya siya pwede mag-cause sa mga pandemics. Okay? Like right now, di ba? We're having a pandemic right now from SARS-CoV-2. So, noong 2003, SARS-CoV-1 yan. Noong 2012, it's the MERS-CoV. Ngayon, we still have the SARS-CoV-2. Sadly. Okay? 55. What is the neurological complication of measles infection that may appear, guys, within 1 month after the appearance of viral exanthem? It's known as your post-infectious encephalomyelitis. So guys, it's not SSP sadly kasi SSP would occur usually 1 to 15 years after the onset of your rashes. PIE will occur within 1 month while your inclusion body encephalitis or MIBE would occur usually 1 to 20 months from the onset of your rashes. Samples for measles infection, the most common complication is having otitis media, especially among young children. But the most life-threatening is having bacterial pneumonia, a secondary infection. Dok, why? Kasi having viral pneumonias can actually alter the normal flora of your respiratory tract. So nangyayari, some become more prominent and therefore can cause infection. So that is one of the most life-threatening complication of measles, having a secondary bacterial pneumonia. 56. The following are genera of fungi that causes cutaneous mycosis or dermatophytosis, except your Trichosporum. Okay, only Microsporum, Trichophyton, and Epidermophyton can cause cutaneous mycosis. Trichosporum is actually the agent causing white piedra, a form of superficial mycosis. 57. Okay guys, more on mycology tayo ha. A 32-year-old male farmer developed a 5 by 3 by 4 centimeter na verrucous mass on his right foot. Upon biopsy, may nakita kang mga sinuses containing sulfur granules. What is the diagnosis? So, epidemiologically wise, farmer binanggit. So, may idea ka na, baka ito ay isang soil mycosis. Tapos, meron kang verrucous lesion, clinically, pero this time, guys, tinan nyo, meron kang sulfur granules na specific for this kind of diagnosis. Your mycetoma. Mycetoma has sulfur granules and is one of the subcutaneous mycosis. Guys, dito please focus muna sa ating mga features, okay? Medyo maraming mga agents, medyo OA sila sa dami, but dito, ang pinaka-important ay ang ating sporotrichosis, being caused by Sporotrix schenki, having cigar-shaped yeast and asteroid bodies. Pag CMV naman, we have your penny bodies. As mentioned guys, mycetoma or madura foot has sulfur granules, while your phaeohyphomycosis has darkly pigmented septate hyphae, also known as Demacia Seius hyphae. Okay, more on that in mycology. 58. A 35-year-old female presented with hard, dark nodules on the hair shafts of her scalp. What is the agent causing this clinical condition? So having hard, dark nodules on hair shafts, that is your black piedra. Okay? In contrast to your soft yellow nodules of your white piedra. And this black piedra is actually being caused by your Piedreia hortei. Okay? Black piedra is being caused by your Piedreia hortei, having hard, dark nodules. Pag white piedra, guys, ang lesion mo ay soft white nodules on the hair shaft. Parang ganito. As mentioned, it's being caused by your Trichosporan species, and both of them are under your superficial mycosis, which only affect your superficial skin and hair. 59. Histopathology of COVID-19 lung patients revealed the following. Okay, meron kang DAD or diffuse alveolar damage and inflammation with mononuclear cells. Okay, kaya guys masagutan to, how? Eosinophils is usually seen in what? Mga parasitic infections, right? Ang ating mga PMNs, saan makikita guys? Sa mga bacterial infections. While the mononuclear cells involving your monocytes and lymphocytes, yun ang ating mga mononuclear cells. Kasi they are not segmented in contrast to your neutrophils. So sila, usually seen in your viral infections. So dito pa lang, ang best answer pa rin, if di mo to alam, sa Robbins ay B. Okay, DAD with mononuclear inflammation. Okay. So, samples for COVID-19. And lastly, last question for COVID-19, what receptor is used by SARS-CoV-2 to enter the hosts of man? It's your ACE2 receptor. That is the rationale why you have a systemic symptoms or presentation for your COVID-19. Kasi the ACE2 is actually expressed by a lot of cells of the human body. Kaya pwede ka may GI symptoms, may mga joint pains ka, may mga lung problems ka, kasi ACE2 is almost found in many types of cells in the body. And SARS-CoV-2 shared this receptor with your SARS-CoV-1, the one occurring back in 2003. Okay? Pero pag MERS-CoV ang usapan, okay, noong 2012 naman, ang receptor niya ay CD26 or your dipeptyl peptidase force. Okay? So, this is more important. Itong dalawa, rare lang yan, baka hindi naman matanong in the exam. Okay? That's all for your medical microbiology and parasitology. Now we head to physiology. Okay. 61. Urinary control is mainly facilitated by the pons. Okay? May mnemonic dear guys, pons, muupo ka sa inodoro para ikaw ay umihi. For females, okay? So pons. Okay, urinary control. So guys, as a simple summary from Byrne and Levy, you have to know at least muna the parts and functions of CNS. Ano ba yung mga ating centers for respiration and control ng urine natin? Pati yung ating mga circulatory. You have to know them kasi they're very important for physiology and in neurology. Kasi if you have a certain lesion in one part of the CNS, magkakaroon ka dyan ng abnormality. So you have to know them. 62. What is the predominant brain wave during REM sleep or dreaming? It's your beta waves. So, kapag ikaw ay beta wave, your eyes are opened during this stage. Okay? Alert wakefulness ka. Okay? Beta waves ang present dyan. Pag gising ka, tapos quiet ka, nakapikit ang mga mata mo, ang alpha waves ang ating magiging predominant na brain wave. The funny thing kasi, pag tulog ka at nananaginip ka, usually seen in REM sleep, nagiging beta wave ka. So, para kang alert at the same time. So, same ang ating REM sleep saka alert wakefulness in terms of predominance for the brain waves. Okay? Now, as you go deeper in sleeping, okay, stage 1 sleep, mga low voltage spindles lang. Pero pag stage 2 and 3 ka, you will have your theta waves already. Lastly, delta waves naman sa ating stage 4. So guys, a very testable concept. Okay? Please take note this in your board exam review. 63. A female having hemibalismus after sustaining a brain injury. Hemibalismus is seen in a lesion of your subthalamic nucleus. Guys, you have to master here localization. Okay, dorsal midbrain can have your Parinode syndrome. Amygdala can have your Kluver-Bucy syndrome. Okay, can cause hyperphagia and hypersexuality. If you have vitamin B1 deficiency and chronic alcoholism, can have Wernicke-Korsakoff syndrome. At ang tinatamaan dyan ay ang ating maxillary bodies. Hippocampus can cause anterograde amnesia. And of course, you have to know your very famous Gerstmann syndrome. Yung kanyang 4 components, guys: agraphia, acalculia, finger agnosia, and left-right disorientation. Pag may ganyan ka, maybe you have a damage of the dominant parietal. Pero kapag ang damage ay the non-dominant parietal lobe, maybe you'll have your hemispatial neglect syndrome, kung saan you have agnosia of the contralateral side of the world. 64. Which statement best describes type 1 muscle fibers? Okay, the correct answer is your D. The predominant form is oxidative phosphorylation. You have 2 types of muscle fibers, type 1 and type 2. Okay? And the best thing we need to understand them is think of a 1 slow red ox. Type 1 has low contraction velocity. They have a red fiber in coloration. Dok, bakit? Kasi they have lots of myoglobin. Okay, they have lots of myoglobin, and myoglobin is color red. Kasi myoglobin is a protein for oxygen storage. Kasi kailangan mo na maraming oxygen kasi type 1 fibers uses oxidative phosphorylation for their sustained contraction. Kaya, kailangan mo ng maraming myoglobin. And dahil kailangan mo ng oxidative phosphorylation, kailangan din marami ang iyong mitochondria for it to happen. So, dahil meron kang mga slow fibers na yan, nagagamit sila for endurance training. Okay? Sa mga marathons, ganyan, sa mga long-term sports. In contrast to type 2, fast siya, white, nagagamit lang sila sa ating mga bursts of energy using ng mga muscles. Yung mga sprinting lang, ganun. Yung mga weightlifting, basta-basta. So, kasi they only need low amounts of energy. So, ang ginagamit lang ay anaerobic glycolysis. Hence, fast and white sila. White sila kasi they lack myoglobin needed to sustain oxidative phosphorylation. Kasi mas gumagamit sila ng anaerobic glycolysis. 65. Which type of muscle sensor can detect muscle tension? So, Golgi tendon organs detect muscle tension. The muscle sensors, they detect changes when these structures are stretched. Doon sila na-activate. Now, in your muscle, we have 2 kinds of muscle fibers. Your extrafusal fibers refer to your typical skeletal muscle fibers. But you also have your intrafusal fibers, also known as your muscle spindles. Sila yan, okay? Now, kapag na-stretch ang ating muscle, okay, ang nangyayari, nababanat din ang ating muscle spindle kasi it's integrated within the muscle body or the muscle belly. So again, as I mentioned before, kapag na-stretch ka, doon ka na-activate. Therefore, muscle spindles can detect muscle lengthening. Okay? So check. Now, the Golgi tendon organs naman, they detect muscle tension. They are actually found naman sa ating tendon areas. Okay? The attachment point of your muscle to the bone. Pag ang ating muscle ay nag-contract siya, magkocontract yung ating muscle, this time, ang mas-stretch naman ay ang ating tendon areas. Pag na-stretch siya, ma-activate ang ating Golgi tendon organ. Therefore, it detects muscle tension. Nagkaka-tension build-up dyan. Okay, so therefore, nagkakaroon ka dyan ng activation ng ating Golgi tendon organs. Therefore, it can detect muscle tension in the process. Ng ating mga Pacinian corpuscles, okay, it detects deep vibrations And of course, your free nerve endings attains pain sensation. 66. Cerebellar nystagmus is a lesion of your flocculonodular lobes. Okay, so guys, don't forget the lesions of your cerebellum. Sabi ng Guyton, if you have nystagmus, it's a lesion of your flocculonodular lobe, the very small lobe here. If you have hypotonia of the muscles, you have problems of the deep cerebellar nuclei, redentate, emboliform, globose and fastigial nuclei. If you have cerebellar vermis problems, you have truncal ataxia. If ang involved ay isang hemisphere, you have your ipsilateral, intention tremors and ataxia, and you tend to fall on one side. Guys, remember, in cerebellar lesions, okay, the presentation of the lesion is ipsilateral to the lesion. Kaya siya, it falls on the same side. Okay? 6-7. What is the primary site of magnesium reabsorption in the nephron? It is the loop of Henle. And guys, take note, a pearl, an odd man out, sodium, potassium, phosphorus, calcium are mainly reabsorbed in the PCT, except for magnesium, kung saan around 65% are being absorbed by the thick ascending limb of the loop of Henle, according to Guyton. 68. Which analyte can be used to directly measure ICF? So, sa unang tingin mo, oh my God, para mahirap siya. But think about this. Can you really measure the amount of fluid inside the cells? More so, the total amount of ICF sa lahat ng cells sa buong katawan mo. That cannot be done. Okay, mahirap siya magawa. So, it cannot be directly measured. Okay. Same yan with our interstitial fluid. You cannot directly measure them. But with TBW, with ECF, plasma volume and blood volume, you can detect them via different analytes. So sometimes guys, you have to understand first the question before answering them. Huwag agad matakot. Okay? Intindihin mo yung question and the options step by step before you answer. Okay? 69. Which is not part of the Cushing triad. It's your fever. Okay, wala ang fever sa ating Cushing triad. So the Cushing triad, okay, these are the effects of your Cushing reflex. The Cushing reflex is initiated by an increase in ICP or intracranial pressure. So ano ba nangyari dyan? This can happen in brain injury. For example, nagka-trauma ka sa utak. Pag nagka-trauma sa utak, what happens? Namamaga ang ating brain. Therefore, tumataas ang pressure within the cranium kasi it's a closed structure. So, you have to have cerebral perfusion pa rin despite that. Kasi, your CPP or cerebral perfusion pressure is equals to the mean arterial pressure minus your ICP. Kapag tumaas ang ating ICP, therefore, bababa ang ating CPP. So, konti lang ang blood na pupunta sa ating brain. Mas kailangan mo nga siya pag mayroon kang trauma, right? For proper repair. So, with that said, ang response ng katawan mo ay itaas ang ating mean arterial pressure. So, gagawin niya ay magkakaroon ka ng hypertension. Okay, para tumaas ang iyong MAB. Para malabanan mo ang increase in ICP to provide adequate perfusion to the brain. Kaso, ang nangyari dyan, magkakaroon ka ng triggering of your baroreceptor reflex. Due to high amounts of blood pressure, ang gagawin niya ay, it will actually stimulate a vagal response. So, nangyayari, bababa ang ating heart rate at bababa ang ating respiration rate. So, magkakaroon ng bradycardia sa kahipopnya. But hypertension, BP will still remain to be high kasi you still need to counteract the ICP increase in the brain. Therefore, sa triad, the Cushing triad, you have hypertension, but you have bradycardia and hypopnea. Pero guys, walang fever sa reflex na ito. Okay? 70. What part of the conduction pathway has the slowest conduction velocity? It's your AV node. Okay? So guys, let's some review of the conduction pathway. From the SA node, pupunta ka sa ating AV node to relay the information na kailangan mo mag-contract. Now, some fibers go to the Bachmann bundle to tell your left atrium na kailangan mo mag-contract together with the right atrium. That's the Bachmann bundle. Now, magkakaroon ng slowing down of velocity sa ating AV node kasi you want to ensure na maunang mag-contract ang ating atria than the ventricles because you want to ensure adequate ventricular filling. Kasi primer pumps ang ating mga atria. If konti lang ang tubig or blood rather na mapunta sa ating ventricles, konti lang ang stretching ng ating ventricular muscles. And according to your Frank-Starling mechanism, okay, the least na na-stretch ang ating muscles, konti lang yung kanyang cardiac output. Therefore, mas kailangan mo ng more ventricular filling para mas mabanat ang ating muscles ng ating ventricles para mag-cause siya ng higher cardiac output to supply blood across the whole body. Kaya, dapat meron kang slowing down para proper and adequate ang filling ng ating ventricles ng ating blood coming from the atria. Okay? Now, ang ating fastest conduction velocity naman occurs sa ating Purkinje fibers. Kasi these fibers are now very thick. Mas makapal siya. Kasi it now goes across to your different ventricles. And per neurophysiology, okay, kailangan makapal ang ating cells. Okay, pag gusto mo mag-conduct ng electricity to allow lesser resistance para mas makatravel at mag-propagate ang ating action potential. 71, which is not a prominent feature of the increased parasympathetic outflow to the heart. So, what nerve provides parasympathetic outflow to the heart? It's your vagus nerve. So, Doc, dapat natin bababa, diba? Kasi it's a parasympathetic response. You're correct. Pero hindi prominent ang ating decrease in ventricular contraction. Because per structure of your vagal nerve, it only reaches the atria. The vagus nerves only reach the atria. Konti lang ang kanilang interaction with the ventricles. Therefore, they only have minimal effect, okay, in lowering the ventricular contraction. They only largely affect the atrial contraction. Hence, hindi prominent ang ating ventricular contraction decrease if there is an increase in parasympathetic response to the heart. 72. This muscarinic receptor causes a decrease in heart rate. So, ang tanong dyan, what receptors are largely found? Okay, what receptors are largely found in the heart? Okay. Ang tamang sagot dyan ay M2. Okay. So, guys, a mnemonic here by Doc Broly. Okay. When you fall in love, okay, first use your brain, then follow your heart, then follow everything else. So, M1 is seen in your CNS centers. M2 is mainly found in your heart. And M3 is seen in your other secretions in the body. Okay? The stomach, etc. Your whatever organs. Okay? Pag na-fall in love ka. So, utak muna, bago puso, bago ibang part ng kartawan mo. Okay? As you can see here, guys, M2 talaga sa ating heart mainly. And as mentioned before, mas atrial contraction siya kasi hindi umaabot ng ating vagus nerve sa ating ventricles masyado. Pag-usapan naman ay sympathetic response, beta 1 tayo in general, okay? As you can see here, guys, dito, meron kang good distribution of your thoracolumbar sympathetic chains. So, libot niya ang buong puso. So, meron siyang effect for both atria and ventricles. Beta 1, you only have one heart. Okay? Pag vascular constriction, always think of alpha 1. Pag beta 2, always think of vascular relaxation. 73. Which mechanism can provide the fastest control of vascular hemodynamics? It's your baroreceptor feedback. Dok, bakit? Kasi it is a neural response. So, lahat ng mga neural response is very fast lagi. It's usually around seconds to minutes. Ang ating RAAS, mabagal lang yan. Okay? It takes 20 minutes before the release of renin bago mag-effect ang ating RAAS. So, matagal siya. And definitely, fluid shifting and renal control will take hours to days bago gumana. So, pag mga rapid control, always think of neurological drives or feedbacks as the fastest means for control. 74. What cells of the small intestine secretes cholecystokinin. These are your eye cells, cholecystokinin. So guys, a very testable concept. Ano ba ang secretion ng mga hormonal cells ng ating GI tract? So, I've separated GMS from the others kasi ang G mo stands for gastrin, ang M mo stands for mutilin, while your S stands for secretin. Yung iba, hindi ganun sila. Okay? Kung may GLP-1 ka, L cell yan. L to L. Cholecystokinin ay yan. D cell, somatostatin siya. Okay? Guys, iba ang ating EC cell sa ating ECL cell. EC cells, serotonin. ECL cells, histamine ang kanilang sinisikret. 75. The most essential step during the pharyngeal phase of deglutition is your C, approximation of the vocal cords. It makes sense kasi baka ikaw ay mabulunan habang ikaw ay lumulunok. So, hinay-hinay lang guys. Okay? So, swallowing reflex guys, ang afferent ay ang ating mga posterior mouth and pharynx. Go to the swallowing center, the medulla. Ang efferent niya, it involves your cranial nerve 5, 9, 10, and 12. Oral phase is the voluntary phase. The others are involuntary phases, your pharyngeal and esophageal phase. These are the events during pharyngeal phase of swallowing. Una, tataas si soft palate, pataas. Okay, to prevent nasal aspiration. Tapos mag-fold ang ating palatopharyngeal folds, then susunod ang ating vocal cords to prevent naman aspiration to the respiratory tract. Then eventually tataas yan sa ating larynx. But take note guys na hindi sabay-sabay yan. Take note guys na sabay-sabay sila nangyayari. They're overlapping. Hindi sila distinct parts para ma-ensure na wala kang aspiration to the nose and wala kang aspiration sa ating lower respiratory tract. 76. Which lung volume is not directly measured by spirometry, it's your residual volume. Yan ang volume na natitira sa ating lungs after forced expiration. Okay, during your spirometry testing. Therefore, hindi mo kayang ma-directly measure ang lahat ng may residual volume na lung capacities. Ang FRC cannot be detected kasi meron siyang residual volume. And ang TLC ay hindi kayang ma-directly measure ng spirometry kasi meron kang residual volume pa rin sa kanyang computation. So, para ma-measure ang ating RV, you can use your helium dilution method. Helium dilution method yan. Dilution. Or body plethysmography. Pwede mo silang gamitin to measure directly your residual volume of the lungs. 77. What is the VQ ratio of a dead space in the respiratory tract? So, VQ ratio, guys, is infinity for dead space. Kasi, pag mayroon kang dead space, you have ventilation, but you have no perfusion. So, per formula, VQ ratio. Ventilation over perfusion. Ang sabi dito, ang perfusion mo ay 0. Wala kang perfusion. Therefore, kahit anong number ng ventilation mo, if 0 yan, ang lalabas na value sa calculator ay infinity. So, infinity ang tamang sagot dito. Pag shunt, iba ang case natin. Kasi pag shunt, okay, pag shunt, pero kang perfusion, so check, may number dyan. Pero ang iyong numerator ay 0. Therefore, 0 over any number sa baba is always 0. Therefore, ang shunt mo, 0 ang kanyang VQ ratio. Pero pag ikaw ay nagmamadali na, guys, just think of this mnemonic. Think of Buzz Lightyear as spaceman, saying to infinity and beyond. Space, dead space, infinity ang ating VQ ratio. Okay? 78, what receptors detect engorgement of the pulmonary capillaries? These are your J receptors which causes dyspnea. Okay? So, pag meron kang engorgement ng pulmonary capillaries, seen in heart failure, nagkaroon ka ng dyspnea, di ba? Mas hingal ka. Kasi your J receptors are being activated. J siya kasi ang location nila ay katabi lang ng mga pulmonary capillaries, a juxtaposition to the pulmonary capillaries. 79. What electron microscopic features of the relaxed myofibril become less prominent during contraction? Is your H and I band? So guys, yan ang ating myofibril relaxed state. Okay, you still have here your H and I bands. Okay, this is the H band. Diyan sila. It only contains your thick filaments. While the I bands are found here. They only contain here what? They only contain here thin filaments. The A band is found sa gitna, wherein they contain both thick and thin filaments. Now, pag nag-contract ka, nag-overlap ang ating mga thick saka mga thin filaments natin. So, in the process, si A band ay nagiging prominent, pero nawawala si H saka si I bands natin in the process during the contracted state of your myofibrils. Okay, so H and I bands are disappeared or less prominent during contraction of your muscles. Guys, for dito, just remember the ghosters of your life. Okay, yung mga nagsasabi dyan ng, "Hi doc," di biglang after a few moments, bye na pala. Ghost ka na after. So, hi, bye. So, hi, H and I band ang nawawala kapag nag-contract ang mga muscles natin. Okay? As mentioned guys, H bands contains the thick filaments only, while the I band contains the thin filaments only, the actin filaments. A band contains both actin and myosin filaments. Actin yung ating thin, ang makapal ang ating myosin filaments. M line, yung nasa gitna kanina, this is the M line. Okay, at the middle. While the Z to Z line, yung katabi ng ating I bands, okay, yan ang tinatawag na sarcomeric unit of our muscle myofibrils. Okay, take note of these concepts for sarcomeric microscopic features. And last but not the least, in physiology, okay, medyo complicated to ng konti, but please, makinig kayo na mabuti. What is the effect of afferent arterial constriction on GFR, RPF, and FF? The correct answer is GFR decrease, RPF decrease, but same ang ating filtration fraction. So guys, let's first orient ourselves with the order, okay, of our blood flow, okay, across the glomeruli. First, dadaan ka muna sa ating afferent arteriole, then pupunta sa ating glomerulus. Then, sa ating efferent arteriole. Yan ang ating flow of blood. Okay, sa ating mga nephrons, okay? So, take note also of this formula. FF or filtration fraction is GFR over RPF. Now, let's check this first concept. Afferent arterial constriction. If mag-constrict ang either afferent or yung efferent arteriole mo, nangyayari, konti ang iyong blood flow. Therefore, in both cases, you will have decrease in RPF. Noted yan. Kaso, iba sila in terms of GFR. Pag afferent arteriole ang nag-constrict, okay, the one before the glomerulus, ang nangyayari, konti lang yung blood na pupunta sa ating glomerulus kasi naipit siya, right? Panaipit siya, meron siyang constriction dito, konti ang blood dyan. Therefore, you will have here low intravascular volume. Therefore, low ang ating hydrostatic pressure leading to low GFR. So, check. Okay? So, low GFR ka kapag afferent arterial constriction. Pero kapag ang nag-constrict natin ay ang ating efferent area, di ba? Lagpas tayo ng ating glomerulus. Therefore, konti ang blood pressure dito pero mataas ang pressure before the site of constriction. So, mataas ang ating hydrostatic pressure sa ating glomerular space, leading to increase in GFR. Diba? The higher hydrostatic pressure in the glomerulus, the higher the filtration rate. Check. Now, dahil ang formula ng ating FF ay GFR over RPF, you have to understand here guys the concept of vectorial analysis. If ang GFR mo dito ay bumaba at bumaba din ang iyong RPF, same ang pagbagsak ng kanilang values. So, ang ratio mo ay pareho pa rin. It's still the same. So, naging 0.5 to, 0.5 din to. Same na halos ang kanilang value. It's still 1. The same pa rin ang iyong ratio, kumbaga. But in contrast, dito sa ating efferent arterial constriction, look at this. Tumaas ang GFR mo, pero bumaba ang iyong RPF. Okay? If ang GFR mo ay tumaas, tataas talaga ang filtration fraction mo. Check. Very good. Pag bumaba ang RPF mo, tataas din lalo ang iyong filtration fraction. Check. Therefore, the filtration fraction actually increases further if you have an efferent arterial constriction. Kaya siya increase filtration fraction kapag efferent ang iyong constriction, pero pag ang constriction ay afferent, same ang iyong filtration fraction. So, that's the concept behind that. Okay? Napag-usapan naman ay plasma concentration ng protein. Walang effect yan sa ating RPF kasi hindi na-affect ang ating blood vessel lumen or diameter. Pero may involvement sa ating GFR. If mataas ang ating concentration ng plasma sa ating glomerulus, marami diyang plasma protein, meron kang higher oncotic pressure. Remember guys, proteins attract water. So water will go more to the glomerulus. Therefore, konti lang yung mag-filtrate na water beyond the glomerulus. Therefore, kapag tumaas ang ating plasma protein, bababa si GFR natin. Okay? Therefore, per formula, only GFR will go down, bababa rin si ating filtration fraction. Okay? Now, kapag bumaba naman ang ating plasma protein, ang nangyayari dyan guys, mas nahatak ang water palabas, going to the glomerular component, going to the Bowman space rather. So, tumataas ang ating GFR. Again, walang effect sa ating RPF. So, kapag tumaas ang ating GFR, tataas din ang ating filtration fraction kasi walang effect sa ating RPF. Since this is the numerator. Okay? Now, lastly, again, ureteral constriction has no effect in the RPF. Obviously, wala naman siyang pakialam doon, di ba? It's not a blood vessel. Pero dahil tumaas ang ating pressure sa ating ureter, okay, this is the Bowman space for example. This is the ureter for example. Tumaas ang pressure dyan, for sure tataas din ang pressure sa ating Bowman space kasi sa isang space, okay, connected sila by a fluid. Ang pressure increase in one side will also increase pressure in the other side. Therefore, the tendency of blood will be going to the glomerulus, therefore decreasing your GFR. Bababa GFR mo, ang RPF mo still the same. Therefore, per this ratio, GFR will go down, your filtration fraction will still go down. Kasi, the numerator is the one only affected by this condition. That is your glomerular dynamics. Very easy, just have to know the concept behind this, the pathophysiology, and this formula of course. If di mo to alam, mahirap sagutan yung question na to. So that's all for your physiology. Okay?